Hey guys, Dr. Nick here. Today was day 4 of my internship at the Alpstein Clinic, and today was pretty fun in another way. It's been half a day with Dr. Ralph and then half a day with the nurses. So I got to see a few patients in the morning in terms of appointments and seeing some neural therapy done and all that stuff. But then also in the afternoon, I got to be with the nurse and also another naturopathic doctor in Switzerland, and we were able to do something really cool, which was leech therapy. So I got to see live leeches put on somebody's neck region, and what that's supposed to do, actually, even in the literature, and it's a kind of traditional therapy that can help with arthrosis, so like even a rheumatic joint disease, and also it can help with migraines and many other pain syndromes too. So if there's a localized area, you can put the leeches on there. It's pretty fun and it's pretty cool. You see, you literally have to kind of put a leech in a little kind of glass container, put it on the person in terms of their back, let it suck on and bite, and you see it when it bites, it kind of like opens up. And then what I was told is that first it produces some saliva to soften the tissue so it gets deeper, and that kind of stings. It's like a nettle sting almost in terms of the botanical. And then once it softens the tissue, it gets deeper and it starts sucking out the blood. And these things start out small and thin, and then once they start sucking on the blood, which can last anywhere from like an hour to two, they get huge. And I don't have a picture for you because I couldn't take a picture of the patient with them on their back, but they get huge, and after a certain while, they actually fall off because they're full. And what you see is continuous bleeding for probably anywhere from 2 hours up to kind of 12 hours sometimes. And the therapeutic effect can happen within 1 or 2 days with the patient, especially with pain where it goes away. And the cool thing is it doesn't take that many treatments. So maybe within 2 or 3 treatments, that problem can go away for a very long time. So it's pretty fascinating that they were able to bring it to the clinic, because I wouldn't really expect that, because from what I asked, a lot of people in Switzerland, or a lot of clinics in Switzerland, do not do this. There's only a handful amount of clinics, so it's kind of this niche therapy that they do, and they even have a lot of athletes and athletic injuries that they help to kind of support their healing when something kind of acute happens. So that was kind of one of the highlights of the day. And then again, in the morning, or then I was with Dr. Ralph, and we saw some interesting neural therapy being done on different patients. And of course, again, like I said before, favorite thing about these doctors that they physically take their time. So got some results back for a patient. He went through it very thoroughly, spent a whole hour to do that, just to go through it, to all the test results, because he realizes that patients have to understand what's going on, and that allows them to ask their questions at that moment and having less questions in the future and uncertainties in terms of the treatment going forward. So that's always an amazing thing that I really appreciate. And again, afternoon I got to also see how their bioresonance kind of technology kind of works. It was just I think it's called the Vitatech, or World Global Diagnostics. So that was very interesting in terms of what it can do, in terms of how it diagnoses, and how it treats, because you can treat systems, you can treat specifically based on the results, but you can also then hone in and treat directly each microbe. So we have from viruses, parasites, fungal species, to actual bacteria species too. So that was really fun to kind of see too. So I guess day 4 overall was another success. I got to learn a lot. I got to be exposed to a lot of different things, and of course, we even got to see their colonics. But I'm not really going to sit in on that because I don't really want to smell that. But it was a fun time today again. As always, all the nurses and other staff have been very helpful, been very forthcoming, and I'm excited to see what happens on day 5, which is kind of my last official day at the clinic for this time around. And we have a lot of appointments with Dr. Ralph and some kind of going over some other stuff with some of the nurses tomorrow in terms of other infusions and other things that they use. But also, like I said, there's other therapies at the clinic that they do have, which is the PEMF therapy, and they also have the colonic hydrogen colon therapy. And they also do a lot of manual work, even liver packs that they have, and they also have a psychological component, which some of the practitioners are focused just on that area for the patient because they realize there's a huge connection between the body, mind, and the soul in a sense, and we can't separate that out when we're trying to heal the whole person and bring them back to unity and bring them back on their healing journey and really get a complete full sense of healing and not just a partial physical part of the healing, because we always forget that part, that it's really important to work on that. And we see that a lot with many patients, that there's that psychological component, but it's not that it's everything's in your mind and then there's nothing wrong with you, because we find things that are wrong with people, but we know that we have to also change the mindset that they can get better and they will get better. And that's my biggest purpose of why I did this trip and why I do many trips and why I do a lot of extra studying, because I know that people can get better. It's all about hope and holding on to that hope and having the realization that it will occur. It takes time, it takes effort on every level, not just the physical, where we just grind through therapies. We have to be mindful of every part of our healing journey. And my job is just to steer the person in the right direction. And hopefully, by being able to see these therapies and hopefully one day incorporate all of them within my kind of office, I'll be able to offer my patients the best of the best. And that's always my goal. Long-term goal is to have the best, not in Canada, not in Toronto, not in Ontario, but in the world. That's what I really want, and that's what I'm passionate about, and that's what I'm going to do. So you will see it. You can hold me accountable now, because this video will be on the internet forever, unless somebody erases it. But you see this in 10, 20 years, if I haven't done it yet, you say, Dr. Nick, why haven't you done it yet? Get back to work and do that shit. So I'm not supposed to swear, but I do swear sometimes because I'm very passionate about this stuff. So it will happen. So again, amazing experience so far. I'm excited for much more to come, and then continued kind of partnership with the Alpstein Clinic, because they've been so grateful and courteous of their time and their ability to just teach, because every practitioner, every doctor, every physician that I've got a chance to be around, they've had an amazing ability to kind of express and educate me on different levels, where it really they dumb it down and make it simple for me to understand and me to comprehend things, so then I can kind of make sense of why they do it and how they do it and the best approach to that. So, and they're always trying to do more for their patients, and they're always trying to go above and beyond. And that's what I've seen with every patient so far who's come back, saying it's been a great experience for that reason. But they always are trying to get better and bring more technologies and bring more therapies that they feel are innovative and can be helpful to support your healing journey. So again, big thanks to Alpstein Clinic. One more day left, which is tomorrow. So again, thanks for watching, and good night from Goss, Switzerland. Dr. Nick out.